is, it's a compassionate guide who walks alongside the birthing person, offering emotional, physical, and spiritual support throughout the sacred journey of childbirth. And during labor, what we do typically is we offer reassurance, a calming presence, gentle encouragement, comfort measures, touch, breath work, grounding practices, support for birth partners, holding space for choices, a steady presence throughout labor's intensity and beauty. So it's really important to have somebody that's there for you, that you feel supported, and is there to also like advocate for your choices. You know, things don't go as planned sometimes. And what I really like to do with my patients and clients is make sure that we're fully educated beforehand on all the different interventions and things that could be offered, so that if something doesn't go as planned, we already know what we're gonna do because we talked about it. We're not acting in fear and like panic. We already talked about it. So we already know that if this way doesn't go as planned, this is what our plan B is, and we can smoothly facilitate it. Pain management options. That's me, by the way. My last birth. Breath work. So there's different breathing options that you can do. Horse lips, center breathing, sighing out the pain. Being very vocal is a great thing to do. Sometimes people can get too vocal and like get way too into it, and that's where a doula comes back and kind of grounds you into centering your breath and your energy. Position changes in movement. Movement is medicine during labor. It's important to rest. So to find that balance between resting and also having that movement where you can allow gravity to do its thing and open the pelvis at the same time so your baby can come down is really important. Massage and touch, hip squeezes and counter pressure. There are some births where, you know, a mom might feel most of her labor in her back, and the next day I can barely move my arms because I'm massaging the whole time or doing counter pressure, and it provides a wealth of relief. And you know, sometimes, you know, we tap in, tap out. I'll show dad exactly what he needs to do to help provide that relief, and then we'll go in and out. It's a team effort. Hydrotherapy, shower, bath, birth tub, warm water is amazing. Hydrotherapy during labor is really, it provides a lot of relief for most mothers. Some people don't like it, some people don't like to get wet. I thought I was gonna be one of those people until I immersed myself in the warm water, and it was a game changer. Like, it was very, very nice. Hot or cold therapy, hot rags, cold washcloths, fans. Sometimes during a contraction, a woman might feel really hot, and then when the contraction is over, you get really cold. So it's really nice to have these options. Usually I'll put some wet washcloths in the fridge. I'll have a crock pot with some warm rags, and we'll just switch back and forth. A lot of the time I tell my clients that during labor, my job is to make you comfortable while you're really uncomfortable. That's just like what we're trying to do in every moment. Mental focus and visualization. Affirmations hung in your room, meditation playing out loud or in earphones. Some people like quiet, some people like to get in the zone in a different way. Aromatherapy and essential oils. Peppermint for nausea, lavender for relaxation, clary sage supports contractions and releases fear, frankincense for grounding and pain relief. I like to use essential oils. Typically, it really depends on the person. Sometimes diffusing in the room could be great, but also it could, like 1 second you might like it, and then another moment it might make you feel nauseous. So I like to put it on cotton balls and kind of just like have it in the area, and then if it's not serving us, we throw it away. Acupressure points that can help with pain and consistent contractions. I am a big believer in acupressure points. They have helped me immensely during different labors, specifically my own. It's something to try, and if it doesn't work, it doesn't work. If it's a placebo effect, I feel like it's worked for me, so I'm just gonna keep doing it. Thank you. Stages of labor. So the first stage is the opening. That's when labor begins. It's essentially 0 to 6 centimeters. You get gentle wave-like contractions. It's usually when you're wondering, like, is this it? Is this happening? A time to rest, nest, breathe, eat, and trust the unfolding. Typically during early labor, I'm trying to tell you to either rest or distract yourself. Forget it's even happening. Because if you don't, you're sitting here like looking at the time, wondering what's going on. Your cervix begins to soften and open. An affirmation that you can tell yourself is, I welcome each wave with calm and courage. Active labor is typically 6 to 8 centimeters. Contractions intensify and become more rhythmic. So this is typically the 5-1-1 rule. You have a contraction every 5 minutes, lasting 1 minute, and consistently for 1 hour, you're in active labor. Typically, you may feel inward focused. Honor that sacred shift. Usually that's when women are not like having conversations around the room. Like if I have a client that calls me and she's like, I'm in labor, and we're talking for 15 minutes, and I'm like, well, have you had some contractions? She's like, yeah, well, I've been talking to you. It's not active labor, girl. Go back to sleep. Now, if we're talking and she's like, I'm in labor, and then we're like having a conversation, she's like, okay, hold on for 1 second. And then I hear her breathe, I hear her moan a little bit, I hear her go inward. Let me put my shoes on, I'm gonna head over there soon. Because that's typically, like you can tell, you don't have to have a cervical check immediately to know that somebody's in active labor. I can look at you and probably gauge whether or not it's happening. So go inward, really, really like harness that power and that energy that your body is telling you. Your body is opening as your baby's journey descends downward. An affirmation that you can say is, each wave brings me closer to my baby. Transition is 8 to 10 centimeters. That is probably the hardest part of labor. And sometimes it's the shortest, sometimes. This is where the veil between two worlds thins, and it's the most intensive and transformative phase. Emotions may arise, you may have fear, you may have doubt, you may have a release. I've seen women cry during transition, and it really helps their body just release all of those stuck emotions, and it helps things go smoother. If you have any fears, if you have any anxiety, if you have any doubt during your pregnancy, work through them now, because they will come up in birth and labor. It's very important. I make sure to work with my patients and my clients about that really carefully, because it's true. I mean, it comes out during that time, especially if you have any history of abuse. Work through it now, because it brings something out in you to be vulnerable in that state. You may experience hot flashes, chills, nausea. Some people do experience vomiting when they're in transition, because that's just, it's the phase. And I like the vom, not that I like the vomiting, but I'm like, oh, this is good because it's coming up and it's making the gravity, have the baby come down. Really the physiological aspect of it, it helps. You are not breaking, even though it might feel like you are becoming. So an affirmation that you can tell yourself is, I surrender to the power within me. Affirmations I feel like are really important. If we go over some affirmations during your pregnancy that you like and it empowers you, just like hearing those whispers during that time just like brings you back and grounds you in moments where you're like, I can't take it. Usually when somebody is saying, I can't do this anymore, they're in transition and like baby's gonna be here like any minute. So that's exciting. I really like this video. If I could just help show, some people don't have the visual when it comes to the uterus and like the different things that happen during labor. I like this video because the uterus is the balloon, and it shows you what the contractions are like and how your cervix needs to not only open, but thin. Like some people don't really get that, so I like to just show this. It's very quick, yeah. No, you can't hear it. I didn't think about that. If not, it's okay. So essentially, thank you.
What you have to do is get your fingers all the way to the very bottom of the ball and then crank it way open, and then poke the ball in, and then you have that. And I would usually have the class do that, stuff their own balloon. It was always fun, and we'd have a good joke about it. And so then we've got that ping pong ball in there, and we're going to inflate it about halfway. About like that. And then you can let that ping pong ball settle into the neck of the balloon. Sometimes giving the neck a little tuck really helps. And then you can let go of it and it'll stay inflated. And I show people how if you just squeeze the side of the balloon like this, not much is happening to the neck of the balloon here, and it's not opening very much. These are the Braxton Hicks contractions that are just practice contractions that are more and more common towards the end of pregnancy, but they don't do all that much to what's happening to the cervix. So real contractions happen at the top of the of the uterus. That's where the power of contractions happens. It's the muscle fibers at the top here getting shorter and thicker, which squeeze the top and then pull up on the side of the uterus here. And just like with real contractions, I have everybody just squeeze and then let go, and then just squeeze and let go. You just have to do a little bit at a time. And you can see how we're getting that effacement or thinning of the cervix down here, and not much dilation is happening while we're still working on shortening the cervix here. And this is a lot of the work that's going on in early labor. It's mostly about that shortening and less about the dilation. So once we get to much more effaced, much more thin, then we're going to start dilating the cervix there. And a lot of people get kind of nervous at this point. It's like, oh no, I don't want to push. So we always have a bit of a joke. It's just like actual labor, where you'd be like, it's okay, just breathe, do it gently, you're stretching beautifully, and then just give it one more push, and the baby will be here. There you go.
It doesn't happen like that, I promise. It might feel like it, but it doesn't. Thank you for that. I like having that visual. I feel like it really does something. The first time I watched it, I was like, whoa, it is literally like that. Okay, so the second stage, that's the pushing. So that's why I wanted to show you that too. Full dilation to birth. It can last minutes, it can last hours. You and your baby work together. Typically first-time moms, from my experience of just witnessing, push a little longer because they're getting used to it. It's okay. You'll get through this, I promise. The urge to push comes naturally. Trust your instincts. A lot of people are nervous about tearing. Everybody is different. I believe that tearing has a lot to do with coached pushing. Does anybody sit there and tell you when to push when you're taking a poop? No. Your body instinctively knows it. It's the same feeling. It's literally the same feeling. And then I think it has a lot to do with genetics too, the elasticity of your skin. So as long as you are doing slow pushing, you're breathing, you're pushing during contractions, you're trying your best to breathe your baby out, you're listening to your provider that agrees with that and knows that, tearing shouldn't really be an issue. At least not a really bad one. You know, there are different kinds, 1st degree, 2nd degree, 3rd degree. Typically the healing can be healed with rest and sits, baths, and just support. Warmth is the best when it comes to healing down there. I've had 3 babies that I've never torn. So, you know, I hope that gives you some hope. You are strong, you are capable of doing this, you listen to your body, you rest in between pushes. An affirmation that you can tell yourself is, I birth in strength, love, and trust. Here's some positions for labor. Let's skip to the next one, and then I'll go back and do that. Thank you. So the 3rd stage is the placenta. So you birth your baby out, your baby's on your chest. Guess what? It's not over. You still have to birth your placenta out. But it's much smoother because there's no bones. It's just like, I call it like a floppy octopus. It's just like, it's just like, that's what it feels like. It just plops out. So it's not scary. It's the final step in the birth process. It usually happens about 5 to 30 minutes after birth. It really depends. It just depends. If you put your baby on your breast, it contracts, it makes your uterus contract, and it'll happen faster. Gentle contractions will help release the placenta. It's the quiet close of the physical birth process. An affirmation you can tell yourself is, I release and receive with gratitude. Delayed cord clamping. Highly recommend delayed cord clamping. All that blood that is in the placenta needs to go back into your baby. That is your baby's blood. It could happen for, you know, it typically takes 1 to 3 minutes for the umbilical cord to stop pulsing. You just wait for it to be white, and then you cut it. It's your baby's lifeline. Even after birth, the cord continues to pulse with life. Your baby receives 30 to 50% more blood volume, supports the brain and lung development, allows for gentler transition, can be practiced with a vaginal or cesarean birth. All of them. Talk to your provider about it now, so there's no surprises. Placenta encapsulation. I'll make this fast, but it is something that I offer, and it's not for everybody, but it is definitely an option. I think that it does help with, like, I've had a baby where I encapsulated my placenta and consumed it, and I've had a baby where I have not, I saw a significant difference. Your hormones are all over the place after you have a baby, and I feel like it helps support the hormonal balance and emotional well-being. I typically tell my clients to start 3 to 4 days after birth so it doesn't affect milk production. Those first 3 or 4 days are really important to you, like start building that milk supply, and then you start the placenta encapsulation. It's often reported to increase energy, so I always have them take it in the morning. It helps replenish your iron and vital nutrients lost in birth. So if you want more information on that, just let me know, and I have some more info. The golden hour after birth, so important. Skin to skin contact with baby immediately after birth, 100%. Keep that baby on you at all times. Delay unnecessary procedures like vaccines, getting the weight and height, and any wipe down. First have that golden hour, that hour of you and just the baby and connecting and supporting the baby's breath, heart rate. Your temperature is going to regulate their temperature, so skin to skin. Even when you have that first hold, take your shirt off, skin to skin with your baby. It promotes bonding, emotional well-being, encourages early breastfeeding success, and it is a really sacred time. It is. Even when my kids have a temperature, now at 6 years old, we do skin to skin because my temperature will regulate her temperature. It works. Thank you. Breastfeeding. Breastfeeding is beautiful. I hope that everybody tries. The first 2 to 3 weeks is hard. If you get through that hump, smooth sailing. If it's really hard and a lactation consultant still isn't able to help you, get them evaluated for a lip or tongue tie. Super important, because sometimes when that is rectified, when it's fixed, the breastfeeding relationship is like night and day. Super easy after that. Begin with the first hour, offer the breast frequently. Those first 2 weeks, gosh, the first 2 months, it's gonna feel like that baby is attached to you. Like literally on your nipple 24/7. Allow that baby to be on your nipple 24/7. It's really important, and it gets easier, I promise. The only way, there's no magic tea, there's no magic cookie, there's no magic herb to have your breast milk supply go up. Hydrate and stimulation. Have that baby on your boob and drink lots of water with electrolytes. That's the secret right there. And a good latch. You have to make sure the latch is right, which somebody will be able to help you either in the hospital, a lactation consultant. I have a load of resources. I should have said, I founded this group called the Doulas Care Collective. It's a group we started off with 4 doulas. We have 30 something doulas now that live in Key West all the way up to Martin County. And sorry, I talk fast when I get excited. I need to slow down. And what we do is we refer people to one another. So if I have a consultation with somebody and we're having a conversation and I'm thinking in my head, we're really not a good fit, I can think of 3 other people to refer to them, because there's a different doula for everyone. It's important that you feel comfortable with the person that you choose to have at your birth. If you need a chiropractor, a acupuncturist, a tongue tie specialist, a lactation consultant, if you need anybody, I've got a referral of resources for you in your area. So if you need a lactation consultant, reach out to me. I'd be so happy to help. Normal behaviors, yes. Short and irregular. The sleep cycles, newborns sleep a lot. They will fall asleep while you're trying to feed them. Tickle their ear, make them a little cold, but also know it's normal, it's okay. Crying as communication is not misbehavior. Newborns have a startle reflex. They twitch a lot, they sneeze a lot, sometimes their eyes roll behind their head. It could scare a lot of first-time parents. It's typically normal. If you really feel concerned, follow that mom instinct and have them see somebody. Irregular breathing, sometimes they breathe fast when they're sleeping and then sometimes it slows down. Skin variations, peeling, they'll have hair all over their body, baby acne, all normal. Their hormones are regulating after, being inside of you for so long. Strong instincts that babies have are rooting, sucking, and grasping. So rooting is when they turn their head like this, they're looking for a boob. That's what they're doing. When they're turning their head to the side, that typically means I'm hungry. Put me there before I start screaming. Gentle care tips: respond to baby's cues with love and presence. They can feel your energy. When I first started breastfeeding, I would get so flustered and like all sweaty and be like trying to figure it out because it feels really awkward at first. The more flustered I got, the more my baby screamed because she felt my energy. So it's important to, if you need to like take a minute, walk outside while somebody else is holding the screaming baby to just ground yourself and then come back and try again. It'll make a big difference. Thank you. Postpartum self-care. Super important. Rest often. You're healing. Don't go out and try and go back to the gym after 2 weeks. Make sure you're resting, okay? Like light walks are really nice, but a lot of cultures typically do 40 days in bed, 40 days in the house. Or a lot of people do in our culture, because who's gonna be in bed for 40 days? 1 week in bed, 1 week on the couch, and then, the third week you can do like light walks around the block and things like that. But definitely have grace and give yourself grace. Eat warm, nourishing foods. Warm foods will absolutely support the uterus during this time. It's really important. Hydrate, breathe deeply, continue with your prenatal vitamin if you're taking one. Offer placenta encapsulation if you feel like that's best for you, if you're curious about it. Care for your perineum, or if you have an incision from getting stitches, very gently. Witch hazel is really good for that. Move slowly, short walks, and allow your emotions to flow. If you feel like you want to cry and you don't understand why, just do it. Don't fight it. It's okay. If you feel like you need more support, if that crying is happening a lot and you have a lot of anxiety and you can't put it into words, see somebody. I know of a really amazing counselor that does low cost or pro bono work. So it's not, if you don't have insurance and you're worried about being able to afford counseling, I have somebody that specializes in postpartum mothers and families. Ask for help, meals, laundry, baby holding. Join a mom group, utilize a postpartum doula. Being postpartum could be really isolating. Even me, after having my third baby and being in the birth world for so long, I felt isolated because it was just me and my baby all the time. I didn't really have anybody who was a fresh mom to talk to, and sometimes it feels like you can lose your identity. Like, am I Wyatt's mom or am I Brandy? I don't know, maybe a little bit of both. But join some groups. I'm gonna start doing a new mothers group. It's gonna be for brand new moms. It's in the Midwife 360 office down in Palm Springs, not too far from here. And I'll make sure that I get everybody's information so that when you do have the baby, if you want to join a little group of moms who all have babies around your age, it could be really nice to have that community. And additional postpartum support and services, just things that I offer. I already told you. Birth doula support, birth tub rental, birth photography. All of the photos in here were taken by me. Lactation services, and I'll have my cards out there if you guys have any questions. But while Dr. Ali calls people into the room to do things, is that you're gonna do that now, or are you gonna?
Well, I'm gonna give my little spiel.
Okay,
first,
sorry.
But
we'll go over labor positions later, basically.
I wanted you to stay up just for a moment,
Okay.
if you don't mind. I'm gonna send midwife Mia up with you, and if anyone has any questions
Beautiful.
about pregnancy, birth, anything at all, you can ask all of your wild questions. It will go on social media, so don't say your name, but any questions at all. And this is Mia of Midwife. You had a question.
Hello.
Was not ready to be up
It's happening.
Hi, I'm Mia. I am a licensed midwife. I specifically specialize in home birth and birth center birth. I'm here to answer questions.
What was your question?
What is your intake on? Because I was seeing on social media, it's called perineal massages or something like
Perineal
that.
massages.
So I guess it makes it easier, or it's supposed to make it easier for when you're doing a natural birth. Do you recommend that one?
So they do kind of two things. So the first part of perineal massages is it gets you used to the sensation of your tissue stretching when you're pushing. So I don't know if you guys have heard of something called the ring of fire. Basically what that means is baby is crowning, so that widest diameter of their head is stretching the vaginal tissue. And so a lot of people describe that as the ring of fire. Doing those perineal massages can help you prepare for that sensation when you're in actual labor. Reason being is because we feel that ring of fire, our automatic instinct is to push, to be like, phew, let's fly through this, get this baby out. But when you fly through that, you also increase your risk of tearing. So I always encourage moms to practice it beforehand because it gives you that mindset of breathing through it, slowing down, controlling your pushing, so that when you're actually in the thick of pushing the baby out, you don't try to just fly through it and increase your risk of tearing.
Any more questions for midwife Mia or doula Brandy? Nice. All right.
Great question. Thank you.
Yeah.
Enjoy.
So I have a pelvis and a spine here, but who in here is planning on having a C-section? Okay. And who in here is planning on having a hospital birth? Okay, so just about everybody hospital birth in the back? Maybe. Okay, thank you guys. So, I'd like to talk about some common myths that might come up with your OB. First myth number 1, your baby is too big. Your baby might actually be too big, but what you want to know is the fetal head diameter and the pelvic outlet. So, the C-section rate should be about 10 to 15% in the United States. Some hospitals, it's about 40 to 60%. Women are just getting pushed towards C-section, so if you want to have a vaginal birth, you have to think about avoiding C-section, unfortunately. It's too late to change providers. It is never too late to change providers. You can be in active labor and say, I want to see someone else. Even if you're in the hospital, you can always change. It's never too late. You want your provider to be supportive to you. Okay, so I want to talk quickly about the cascade of interventions, but before I do that, the hospital is the safest place to give birth. That's actually a myth. They did a study and home births were safer for mom and baby. Pelvic pains before and after birth are normal and don't have treatments. So if you do have pelvic pain, there are treatments. We have prenatal chiropractic, and we also have pelvic floor PT as well. So lying on your back is the best position for birth. Who's heard this before? That lying on your back is the best position. Okay, so lying on your back is the best position for the doctor. It's easy to see what's going on. They don't have to go like this. This is why Mia has back pain. But it's actually not a great position for you. So when you're going to have birth, you're going to feel like you want to get in certain positions, and you should get in that position. When we lay on our back, we may actually do something that's not going to allow us to birth as well. So this is your spine, this is your pelvis, and right back here are these SI joints. So when you give birth, the pelvis needs to open like this. When we're on our back, it's just a little bit harder to do that, and we're not pushing with gravity. So if we're giving birth here, baby's going with gravity. On our back, baby's against gravity. Now, I say all that, but if you're in birth and you feel like you want to be on your back, go on your back. Your body's telling you something.
Can I add something to that?
Yes.
You were speaking about like laying on your back, and I know sometimes like birth does warn us to lay down. A great alternative is to do alternating sidelines, so you can push on your side instead of being directly flat on your back.
Yeah, you can go side to side. Once you had a C-section, you can't have a vaginal birth. I've had a lot of women come through my office that have had successful VBAC, so if you've been told that you can't have a vaginal birth, go see Mia, she'll help you out. Cascade of interventions. So, unfortunately, once you do one thing in the hospital, it's really easy to get pushed into other things. So it usually starts with the epidural. Now, once you have the epidural, you need to do IV, you need to be stationary. Now you can't move around for birth, but also the epidural is not going to allow you to push as much, possibly, and then you might need something called Pitocin, which is going to speed up labor, and that can cause tearing, and it can push you to C-section a lot of the time. So whenever something new comes into the room that the doctor's recommending, you want to ask yourself a couple of questions. What are the risks? What are the benefits? And is this actually going to help my labor right now? So before we go into how you can prepare for birth, I just want to touch a little bit your little one. So all of our subconscious experiences develop when we're little. And for a lot of little babies born in the hospital, the first thing that happens is pain. All little babies have to go through pain to get into this world, but then they're in bright lights, which cause a startle response that instantly shift them to a sympathetic state. So it's kill or be killed. They're really stressed out. And then they cut the cord as fast as possible. I know the doula touched on this. That doesn't allow them to get all their blood flow. And then they typically take baby away from mom, and mom still has a lot to go, and she can bleed out pretty easily. Although when baby latches on to mom, it helps that. So everything natural has a purpose in birth, and a lot of things in the hospital can stop that natural flow. So know what's natural and try to keep that natural environment if possible. A lot of times they'll sting the eyes with antibacterial just in case you have gonorrhea, and then they'll inject vitamins with a needle, and then they say come back for a circumcision. So just think about how your baby is being brought into the world. The number one predictor of whether or not we're going to be happy is if we think the world is for us or against us. So if you want to create an environment that allows your baby to think that the world is for them, that would be awesome. So the most important piece to prepare for birth is actually your emotional well-being. So in order to give birth, you have to be in a social parasympathetic state. So think about this state that you can orgasm in. Maybe lights, maybe with your partner, but maybe not with your mom right next to you in bright lights in a hospital, right? So you want to be in a very relaxed state. You can get into this with breathing techniques. Birth is scary for a lot of first-time parents. It's painful. We're going to talk about some breathing techniques that you can use. And then you want to have a well-regulated nervous system. So that's kind of where I jump in. I work with the nervous system to bring everything down to a daily calm so that you can practice and prepare for birth. So you want soft lighting, good smells, soft things around you, and have a good birth plan. So who in here has a birth plan already? Very cool. If you don't, you can go to earthmama.com. They have a place to pick a birth plan, or you can do a birth plan with your doula as well. So, social. Choose your birth team. Who do you want in the room? If you don't feel comfortable being fully naked in front of somebody, they're probably not the right person to be in the room. I've actually gone to help a few mamas that couldn't progress in labor, and they had a bunch of people around them, mom, aunt, uncle. I typically ask everybody to leave when I do the adjustment, and all of a sudden they start to relax. And yes, the adjustment helps, but I think just getting everybody out of the room really helps. So, emotional training for birth, visualize. Who has a fantasy football team right now? Okay, cool. All of those pro athletes are visualizing what's going to happen on the field before they get on the field. That is a crucial piece. You should be visualizing every day, multiple times a week, what you want to happen, and it's more likely that what you want is going to happen. So, hypnobirthing, surge breathing. Has anyone kind of dived into surge breathing?
I did research on it, but I didn't practice it.
Okay, there's a lot of free podcasts, so definitely download one. Look at it 3 to 4 times a week. This is going to help you through a lot of the stages of labor. The transition section, that really painful 30 to 3 hours at the end, we're going to talk about another breathing technique that's really helpful. But if you do one thing today, learn hypnobirthing or some type of adjacent breathing technique. So J breathing, this one is what I've heard is really good for transitional breathing. So it's where you moo like a cow, and it's also really funny to practice. So all of these breathing techniques you should be practicing before the actual event as well. Pushing. So Another common myth, don't eat or drink before you give birth. It's like not eating or drinking before you run a marathon. The only reason why they tell you not to eat or drink is because they're expecting that they'll have to intubate you for a C-section. You guys are not going for a C-section. You're doing natural birth, so you can eat, you can drink. Learning how to push. So if for some reason you're not quite sure, I really recommend going to a pelvic floor PT. They teach you how to push, so there's no confusion day of. I'm gonna talk to you about some things that you can do to prepare, but if you're still confused, you can get a consultation. You don't have to do like a whole course of treatment, and it'll just prepare you to push. Working out, if you work out already, you can continue to work out throughout your entire pregnancy. Just don't do a whole lot of abs. And then you wanna make sure that the neural input to the pushing muscles are strong. So we don't really use pushing muscles in everyday life so much, but this is your spine. Brain sits up here. All the information has to go from the brain through the yellow spinal cord and out through these nerves. Now what can happen is the spine can misalign, and that irritates these nerves as they exit the spine. So now the message is from the brain out through that nerve, sometimes they don't get out as effectively, and these nerves from the lower thoracic and sacral region go to the pushing muscles for birth. So I make sure all these vertebrae are aligned, all the pressure is off the nerve. That's gonna take a lot of stress off of your system, but it's also gonna make sure that you have access to all of those pushing muscles. And then I also do some ligament balancing. So if this is your pelvis, you have the uterus sitting right inside the pelvis, and we have a couple of ligaments that attach the uterus to the pelvis. So one is the broad ligament. It attaches from the sacrum to the bottom of the uterus. So let's say that sacrum is twisted, that ligament is twisted, well, the whole uterus is gonna twist. And we want the uterus to be straight inside the pelvic cavity for the best birth. Another thing that can happen is these round ligaments from the side of the pelvis to the uterus. One can be in spasm, and now the uterus is tilted off to the side. So when baby descends, it's gonna hit the pelvic bone, come back up. That's called stalled labor. So I make sure that the uterus is a straight shot to go right through. Okay, pushing versus clenching. So someone said, breathe your baby out. What does that mean? So pushing is more about letting go than really clenching down. So visit a pelvic floor PT to assess if your pelvic floor muscles are balanced, and then practice letting go daily. So let's talk about pelvic floor relaxation. So you want to visualize that your pelvic floor is dropping and opening like a flower blooming. So if you're not quite sure what this means, what this is, you can take a towel, roll it up, and kind of stick it, and guys, you can practice this too, just if you want to be helpful. Stick it between and feel your pelvic floor coming down to meet the towel as you're relaxing. So this is to get your mind connected to the muscles that you're going to use, and you want to practice this a lot. If you're still not sure, you can think about going to the bathroom. When you stop, that's not what you want. When you finally let go and let the pee out, that's the sensation that you want to practice. Okay, some more pelvic floor relaxation with diaphragmatic breathing. This is something that you should do every single day to prepare for birth. It will improve your birth outcomes. So you want to have that relaxation of the pelvic floor while you take deep breaths. So I'm going to have everyone in the room practice this so that you can practice it later on, and then if you have any questions, you can go ahead and ask. Okay, so let's sit comfortably. Let's inhale for 5 seconds. 1, 2, 3, 4, 5. Imagine the pelvic floor dropping, and exhale for 7 seconds. 1, 2, 3, 4, 5, 6, 7. Who felt their pelvic floor tighten up on the exhale? And you don't have to raise your hand, but a lot of times that happens. Just practice keeping it nice and soft, nice and loose. Perineal massage. Someone asked this question. So what is this? How do I do it? How do I help prevent these episiotomies? So you're gonna do a U shape. Partners, you can do this as well, but you go down and around. It typically helps to have some sort of lubrication. Make sure your hands are clean. I feel like that goes without saying, but you gotta say it. And you can do that 7 days a week. Some providers recommend only doing it after the 34th week, but from what I've been told, you can start as early as before you're even pregnant. So, supported deep squats, these are a really good one, and they're gonna go with that pelvic floor relaxation. So you'll notice that the pelvic floor relaxation comes up again and again. So I would do this one definitely 3 days a week. That's really gonna help. And you can do the standard squat, but you can also play with it. You can go a little bit further and try it. You can go side to side and build up your leg muscles. And then the butterfly stretch as well. So just note that all of these exercises, all of these stretches, you're practicing it with relaxation of the pelvic floor. Cat-cow stretches, these are my favorite. Is everyone aware of the cat-cow, how it works? Yeah? Okay, so just practicing these with pelvic floor relaxation. Okay, you also want to make sure that your pelvis is moving. So, back to our pelvis. When we walk, our pelvis goes like this. When we give birth, our pelvis goes like that. A lot of times, because women, we sit all day long, one or both of these SI joints can become fixated and it's harder to open. It's more easy to get stalled labor. So what I do is I make sure that both of these joints are moving so that the pelvis can fully open for birth as well. On average, 2 hours shorter labor. So what I do is called Webster's technique. It was originally called the baby turning technique, but we don't turn babies. What we do is we make sure that the uterus has the most room to expand within the pelvic cavity so that baby can turn naturally if it wants to. And if your baby isn't breech, it just means that baby has enough room to play. Okay. I think our doula is going to come up and talk about some birthing positions. Brandy, you wanted to do some birthing positions?
Yes.
Yay.
Okay.
You like to slide?
No, it's okay. Okay, so I hope it's okay with you guys if I call you up one by one just to practice. I won't make you like get on the floor and do crazy birthing positions, but it'll be really nice to just have that muscle memory now so that in the moment you'll be like, oh, I remember that girl at the chiropractor that showed me that, that one. So, I'm gonna hold this here. I will do a very basic one for everyone, I promise. If you can come up, please. Thank you.
Just me?
Nope, both of you.
Come on.
Yep. So, one that I really, really love that helps bring the oxytocin into the space and allows you to be upright and have gravity do its thing is you will have your hands on his shoulders. It's nothing crazy, I promise. Come over here. Face each other.
We've never done this before.
I love it. Hands up on his shoulders. He will hold you right here and support your weight so that you will open your legs a little bit more and you're going to be just swaying side to side. And you're kind of going to drop your weight a little bit and he'll be just supporting you so that you know that
Like drop down or drop back?
Yeah, like that. Perfect. Okay. And then typically your head will be down, you'll be breathing. He can be doing whatever makes you feel loved. Kiss your neck, whisper sweet nothings into your ear. And then just that typical like swaying back and forth really helps this open up and helps bring baby down.
Hard
and
if you're short.
I know, that does have to work out. But that's a really good one. That's a really good one to transition from like, I'm laying in bed and I have to go to the bathroom, but hold on, I'm having a contraction, let me stop for a second. And then you guys can do that. Brings oxytocin and gravity. Awesome. Yeah. Next. Come on. So, a labor position that could really, you're wearing a dress, so I'm not gonna make you do anything crazy. try the same one while I try and think of a different one. So here we go. So you're going to open your legs a little more. Yep, sway back and forth and just drop that weight. And then you just support her as much as you can. That would be great. Another position to that could be really helpful is if, I'll do this one, but you can be up here and just watch me, is if you're like leaning over the couch or leaning over the hospital bed and you're swaying your hips like this, back and forth, and you can be behind her. Hold on to this, come behind her, and may I touch you?
Yeah.
Okay, thank you. If you just squeeze her hips like this and kind of bring it up, that is so relieving. So give it a go. There you go. This is gonna be amazing during labor. That's gonna help her a lot, and she'll guide you as to when to squeeze, right?
Yeah.
Practice every night. Good job, guys. During labor and all of that good stuff, during a contraction, that type of counter pressure on the back is really good. Another one, please come forward. We're gonna do everyone's gonna do the swaying. I love it. So hands on his shoulders, you support her. I know you're so little, you were like on your tippy toes.
Ready to do that in heels.
Right, and then that's what you're going to do. You're gonna be able to just let go a lot of, like, the biggest thing to remember during labor and childbirth, surrender. Don't fight it. Good job. It comes in a wave, so you're gonna feel it come up, you're gonna feel it peak, and if you're scared and fearful, you're gonna like wanna clench all of your muscles, but if you just surrender and loosen everything, it will help your pelvic floor surrender and loosen and be able to open. So that's a good labor position. If you don't mind, because you're wearing pants, if you can get on your hands and knees, this is a really great one as well. I'm so sorry.
I know.
do too.
I'm a cracker.
Too. So if you get on your hands and knees, that would be great. And typically people think that when you have your legs open, your pelvis is opening, but it's actually quite the opposite. If you put your ankles out and your knees in, it allows this area to open more. So this is a good one to practice. Practice it, do the cat-cows, like the yoga pose, and just sway. Movement is medicine. So that's a good one. Good job. You're so welcome. Next. So if you guys can start off with the sway, the love sway, I call it. I love it so much. And then you support her so that she can just, yep, there you go. You bend your knees. It's called bearing down. When you feel a contraction coming and you feel that pressure down there, it literally feels like you have to take a poop. And you bear down and you kind of just like drop all of your weight into your pelvis. So that is beautiful. That is perfect. Amazing. What we can do, I'll show you. I'll just show you. I'm not gonna make you guys get down. Another good one that she was saying, a side lying, is a really great position to push in, where you're laying like this, and then you have your other leg up. And it's a really good position to be able to like still lay down and rest, but while also opening your pelvis. Sometimes you can use a peanut ball or a bunch of pillows in between your knees to like rest during a contraction, and it's a really good option to have. And then you flip-flop from side to side, kind of like a rotisserie chicken. We just like go back and forth, okay? Thank you. You're so welcome. Next. No rush, take your time, please. And you guys can say no to me, but please don't. So yes, your supports. Just put your hands on her shoulders. Make sure that you can bend your knees and like kind of release that weight and just feel supported. Okay, and then yep, somebody that you're super comfortable with, that you love, and you just sway back and forth. You sway back and forth. Another good one, and you can try it, is let's say you're standing and you're leaning over the couch or the hospital bed, and then you have one leg up. I call it, what is that? What is Captain Morgan? Captain Morgan stands with his leg up on the thing, because it really allows your pelvis to open up and just create more space in the area. So give it a go. You'll be typically leaning on something.
Like this?
Yeah, like that.
Oh yeah.
And then you, right? It feels good. And then you switch from side to side. You do that side for 2 contractions, 3 contractions, and then you flip to the other side.
Here, you try. You can be next.
You're the pregnant one.
But you're gonna be next.
Don't put that on Chris. Just kidding. Can I be your support person back there? So, hello, nice to meet you. So typically you want to be able to open your legs a little more like that. You can drop your weight a little bit, and yes, your support person again here to help you feel supported and loved. A little caress, of course, yes, it's nice. And then like during a contraction, you can bend more and you can bear down. And then when you're done, you can get up.
Okay.
And then all that good stuff.
Yeah.
Feels good.
Kind of hard for 6 hours yesterday.
Aw. You need the massage.
Yeah, he's working, so
Okay.
later tonight.
Well, please tell him about all of this. Sorry, I just hit your belly.
No, you're fine.
But it's pretty instinctual. If I'm gonna be honest, you did a great job. Thank you. All of the labor positions are pretty instinctual. It's nice to look at labor positions, practice them, but in the moment, you're gonna do what feels really good for your body. It's important to just like keep switching it up. Don't just stay in the same position for a long time because that could just, it's not really gonna do much.